Excellent. Thank you for joining us. So, as Joe said, my name is Tamara Martinez-Anderson, and I currently serve as the Director of Admissions at the School of Medicine at the University of Nevada, Reno. There I have kind of a responsibility for three different areas. One is addressing the workforce shortage that exists with physicians, especially in the rural parts of the state, and to do that as well as underrepresented populations. So to do that, I oversee outreach operations where our goal is to inspire young people to consider a career in medicine. I am engaged in outreach to high school students where we put role models in front of them and let them see that there are possibilities to go into medicine. Maybe they have not met anyone. We especially work in kind of underrepresented high schools where they may not know a physician short of going into an emergency department. And then we work with our pre-med students in helping them understand that the world of admissions in medical schools has really changed, that we have moved to a holistic model where we have much greater expectations than someone who's just academically gifted to go to medical school. The second part of my role is involved in what we refer to as our pipeline initiatives. And right now we have two programs where we reserve seats in medical school for a select group of high school students who come into a structured program where they do 4 years of pre-med education and have a reserved seat waiting when they're done. And a second program that's a post-baccalaureate for those individuals who maybe came to medicine a little bit later before they got serious about their academics, or perhaps they're a career changer and they did not do sufficient science to be ready for what we're going to expect of them as a medical student. So they go back and do a 1-year post-baccalaureate. And again, if they're admitted to that program, they have a reserved seat waiting for them. We're also developing new pipeline programs, again, to address workforce shortages. So we have a program with Great Basin College where they have a brand new, they're one of their first 4-year programs in biology, and we're really supporting them because even though they have a 4-year program, they don't have pre-med advisors, they don't have a career center that understands what they need to be doing to get ready for medicine, they may not have access to get the types of experiences that they need. And then we have a program with TRIO, which is an undergraduate program I'm sure you have here, where we work with students who, again, may not have as much direction and guidance in how to move towards a career in medicine. So that's one area of my position. The second area is really just the admissions portion of it. I'm overseeing the process of over 1,500 applications, interviews of over 300 individual students who go through multi-minute interviews where they rotate through 9 different 7-minute interviews, all 300 of them over the course of 4 or 5 months. And then the actual review of all of those applications in an individual holistic manner that looks at competencies. And then finally, so between the pipeline programs and the outreach and the admissions, it's a very full position and one that I really enjoy. But what I'm sort of here today is to talk about the pathway that got me there. And it came right through this building very much. And I wanted to share a little bit about what I took away from my education here at Utah State. So the first thing to know about me is that I began my liberal arts education in a bookmobile. You know, I grew up in a home where there were no books. And I had a father who was literally born in a 1-room shack in the hills of New Mexico, who was a great salesperson who worked for a car dealership. And one day General Motors came calling because he spoke Spanish and he knew how to sell things. And because of his work ethic, because he was this guy who just could figure out how to get things done and really thought on his feet well, we ended up moving to Detroit where he worked at the GM building. And before we knew it, he was traveling the world. And we had the opportunity to live overseas in Panama. My mother, on the other hand, would deceive everyone she met into thinking that she was a homemaker who had kind of a passion for arts and crafts. But she as well was someone who every time I turned around seemed bored with being at home and was taking temp jobs in companies where, again, we would turn around and she would be promoted into the payroll director at a big chemical company. Or she would decide that she was bored and so she'd start making candy and putting it in boxes. The next thing you know, she was running a business out of the home. She did these things again and again. She was kind of this serial entrepreneur slash person who, over the years, even though she didn't grow up around computers, before she knew it, she was like building databases. So I came from a couple of high school graduates who nevertheless just always knew how to get it done. But when the time came to go to college, I attended Business Week here at Utah State back in 1984 or 83, sometime way back when. And that introduced me to Merrill Hall and made me feel very comfortable on this campus. So when I graduated from high school, this is where I came. And my parents were asking a lot of questions. They really didn't understand why I didn't just go get a job. That's what they did. And surely that would be enough. And so I spent about a year and a half here. One of the things that happened was I stopped reading those books. I was so concerned with getting good grades, with trying to figure math out, which really did not come easily to me. I got a job on campus, I got involved, and what ended up happening was I got really bored, and I just didn't know why I was in college. And so I saw an ad for a job, and I applied, and I got it. And 5 years later, about maybe 6, I was the conference catering director at a huge resort hotel in Park City. And I was making as much money as my mom was. And I thought, wow, this is the life. And I was having a lot of fun. I skied. I hung out with all the concierges in town because every client that came in that was holding a big conference, I had figured out how to send them out to have a good time. And in the course, people were buying me dinners, and my clients would bring me big flowers and thank me for the job I was doing. And I thought I was done. I thought I'd found my career. But then something happened because I started hanging out in the back of the conferences. And every one of these groups, whether they were accountants or lawyers or doctors or business people or engineers, would come and put on these fabulous conferences where they would do these presentations and talk about the work they were doing. And I would just lose track of the job I was doing and sit there and listen to their presentations. And the same thing that used to happen when I'd come off the bookmobile with books like this happened in the back of those conferences. And suddenly, as much fun as I was having, my brain started going, no, I want to know about this stuff. I want to know why things work. I want to know what it is that I can do to make a difference. I want to be like these individuals that are coming here for a week and sitting in these meetings and learning. So that same drive that I had back on the bookmobile to just grab random books, and the same thing that happened when I would go to libraries started happening there, and I made the decision to return to school. So kind of reignited my desire to learn, but this time when I came back to Logan, it was with a completely different approach to education. So I was ready to learn. I wanted to know everything. I didn't really care about grades, except for suddenly the grades came really easy. Because essentially I had a mission, and I also knew I could get a job. So for every student that's here that thinks, is hearing that message of you're coming to college so you can get a good job, I found out that you don't have to go to college to get a good job. And so I didn't have to come back here thinking that that was my purpose. I was coming here because I wanted to learn. And studying became an opportunity. It was where I got to look up new words that I'd never seen. And it's different now when you've got an iPad and you can just click a button and see what a word is. But I had this great little red dictionary that is highlighted still with every word I came across that I didn't know. I was so curious about the world around me. And I wanted to understand how things were connected, because even as I sat in the back of those conferences, I would hear things from doctors that connected to things that lawyers were talking about. And then I would hear something from a business person, and I'd think, oh wait, I heard about that 3 weeks ago when that other group came in here. So I was really curious about how all these things connected. I was curious about people. What were their motivations? Why did they behave the way that they do? These were questions that, as a freshman out of high school, coming from a family where books weren't all that important and learning was just seen as something you did on the job, just never occurred to me when I was younger. And I also really wanted a different kind of career. Yes, I had fun, and yes, I felt like I was making these guests of mine, these clients, that I helped them enjoy their stay and have a great vacation and learn something while they were there. But I really wanted to make an impact. So my first semester, I still can't believe it because I am not a morning person. I took a 7:30 a.m. class. I was so excited to be back in school that I did it. And I got incredibly lucky because my professor was David Lewis, and he's an emeritus here. But he is that history professor that every once in a while would dress up like a character in history. He would climb up on top of tables and tell us stories. He was something else. And I just could not help but capture his energy at 7:30 in the morning. So that was the first thing. And then because I had, along this way, picked up classes here and there and had a lot of classes, when I went to an advisor, one of all of you, and said, so what do I do? And they said, well, if you ever want to graduate, you really need an interdisciplinary degree. So all these diverse classes you've taken can all come together to something. And for me, that meant I got sociology and psychology and anthropology. And just as any of you who are in those areas know, that's where you start discovering how to think outside the box. You help start seeing those connections and why things work the way that they do. It challenged my belief system. I had to stop and think about what really matters here. So I still remember the day in an anthropology class that I read the definition of a radical feminist, and I went, oh, I think that's me. Could that be me? Because it really wasn't the way I was raised to be radical about anything, and certainly not a feminist. But those are the types of things that started happening to me everywhere I went. I started figuring out who I was, and where I fit into the world. I started taking some English literature classes where I was challenged not to just randomly choose books, to be thoughtful about what I was reading. That maybe rather than just reading the classics, that I should be looking at books written by women, artists, authors. And so I would take classes because I would think I want to know a little bit more about this world that I live in. I started developing a social conscience. I learned about patriarchy. I learned about queer theory. I learned about the discrimination in our world. I learned about inequity. Things that I have to confess, up until that point, I just really didn't know a whole lot about. I just kind of moved myself through life and did what I did. History is where a lot of this all came together for me, and it came together in part because of that first class with David Lewis, who then took the time to introduce me to his colleagues. And I would show up in his office with a question, and he'd say, you know, the best person for you to talk to, go see Clyde Milner. He works at the Western Historical Quarterly, and he can answer your questions. Go see Ann Butler. So these are individuals who have since moved on from Utah State, but who seriously invested in me as a student. And they were willing to mentor, and they were willing to listen, and they were willing to answer questions. And they gave me an opportunity to intern with the WHQ. Something that I never could have imagined. I didn't know what quarterly journals were. I didn't. They said I should go get a PhD, and I said, a PH what? It was an eye-opening experience. It was a time when the history department had made a conscientious effort to have a more writing-intensive curriculum. And so some of the courses I took, we would journal, and we would write about what we were hearing. One of those classes was a women's history course, where suddenly some of the things that had occurred in my life, working up in a big resort town, getting passed over for a promotion in place of a man who I knew didn't have the experience even at 25, I knew this. I started writing about these things and discovering a little bit more about the world around us, and that there were things happening that I was not aware of, that I didn't have names for. And finally, I just really, the other part of this was that on top of all the great things happening in my education, I also landed a work-study job at the Fine Arts Center, where I saw symphonies for the first time. And I saw contemporary dance. And so it was more than just the classroom education, but it was everything that was happening on this vibrant campus that somehow I missed out on the first time around. In terms of university life, I found out that there were speakers like this that I could go sit and get a free lunch and listen to. I just was exposed to culture and social engagement, as I think where I was starting that. We had a problem with the flash drive, so I got an old version of the PowerPoint. By social engagement, this was back when the LA riots happened, and I can remember gathering with other students on the quad to talk about what was going on in LA. And there were international students on this campus who knew so much more about our country and our world than I did. And so I started hanging out with them. Just overall, it became my life. And different inputs means different outcomes. So by taking this broad array of classes, by surrounding myself with culture, by taking advantage of everything that the campus had to offer, what came out of that was just a really different thing. And what I would say is that my takeaways from my time on campus, first it was critical thinking. I learned to challenge everything. I learned to ask why. I learned the importance of evidence and of analyzing and evaluating things before I came. Before I made a decision, I wanted to break everything down. I also developed a major mentor mindset because of the people who took the time to sit down with me and explain things and break things down for me. I knew I had to pay it forward. I needed to be able to engage with others. I also developed what I kind of refer to as everyday ethics, a sense of what it takes to do the right thing and what happens when you don't. My engagement with the world, I realized that we are all connected and that I had a responsibility to really get to know others and to see how sociology and anthropology and philosophy and English and history, how they all could connect together and change the way that I engaged with the world. I became very big picture focused, which I actually think was something that was just inherent in me all along, but it really drew it out. I started asking why about everything. Well, why are we doing that? Well, why is that the right thing to do? Why? I became a 2-year-old again. And finally, I feel like I just developed the self-awareness that I need books in my life. And yes, the internet has somewhat supplanted that, but every once in a while, I just need to read a book from cover to cover. It feeds my soul. I'm a learner at heart. And my passion, I discovered after all of this, really is education. So those are the things that I took away. And when I left here, of course, what do you do with an American Studies degree? You go to graduate school, you become a professor. And so that's what I thought I was headed to do. And I was fortunate to be admitted at a number of schools because I had great professors who were willing to write letters of recommendation that I think made all the difference. And I ended up at the University of Michigan. And I went right into a PhD program. And within 2 years, my then boyfriend, now husband, who I also took away from Utah State, he's my other big takeaway, his father passed away, and he felt compelled to finish his degree to honor his father. And he says he paid tuition at Utah State and came here to meet me, and that's about it. He didn't do a whole lot more, but he certainly got serious about school as well. So I followed him to the University of Idaho. And in 3 or 4 years, I was an assistant dean at Gonzaga University School of Law. And I know that the reason that happened so fast was because of all the takeaways that I had, because I was a good critical thinker, because I could see the big picture, because I knew how to ask good questions, because I saw how things were connected. And so it really changed the direction of things. I never did go back and finish that degree because suddenly I was in a career where they asked me to travel all the time to recruit students. But slowly but surely, I moved through a series of university positions in administration. And I got to bring back all of the things that were important to me. Because in the world of admissions, there has been this slow but sure recognition of how important it is when you admit students, especially to professional programs, that it's not just about being really smart, but that if we want good lawyers, if we want good nurses, if we want good doctors, that we also have to look holistically, that we need them to especially for doctors, they need compassion. They need to be reliable. They need to be dependable. They need to have some grit and resilience to get through medical school. And so I started developing an explanation of what it means to again see holistically and to see the big picture and to see that the decisions you make at the admissions table have impacts on workforce shortages and on the types of physicians that are working in our world and all of those sorts of things. So my pathway after Utah State moved me to University of Michigan and off to Gonzaga University, where I worked at the law school there. I spent time at Michigan State. I took a brief break from professional schools and worked at the South Dakota School of Mines and Technology as their director of admissions, where I learned a lot about engineering, but eventually ended up with this medical school admissions position, where I just feel like I continue to utilize everything that came to me as a result of being here and moving on this pathway towards education. So now I'm in Nevada, and I feel like every single day I'm using the very things that I got here, and it's been really a lot of fun to go back and think about what was it that kind of laid the foundation for this career path for me. So that's what I have for you today. Questions or thoughts on this? Yeah.
You mentioned a lot of different opportunities that you've had working in various fields. I'm just curious as to how you first heard about those opportunities and through what avenues. Did you search them out? Did you see them on a flyer? And how did that evolve over time?
So some of this, I mean, I think in some ways it really started because my husband was still in school. And so I was in Moscow, Idaho, and there isn't a lot of industry. There's 2 colleges, one in Pullman and one in Moscow. And so you go to work where there's jobs. And so I started as an admin assistant in a department. But what really, the big difference was there that it doesn't matter what you're doing if you're kind of putting your heart into it and finding creative ways to get things done and not just there kind of checking the box of, oh, yep, got that taken care of. You need me to make an appointment for you, we'll make an appointment. And then the second thing was that I kept living like I was a student. I kept going to lectures. I kept showing up at things where there were people that were engaged in community life. And I kind of developed the ability just to talk to anyone and ask them what they were doing. And that really indirectly led to an opportunity at the law school at U of I. So yeah, you can, I think you make the most of every situation you're in. Once you're in higher education, for me at the law school, I got sent to a conference, and that's where I found out that what I was doing at the University of Idaho, other people were doing at law schools that gave them big titles and big salaries. And I didn't know that at the time. But once I went to the conference, I suddenly went, well, that's exactly what I'm doing. I can do that too. And again, kind of took on that fearless, I'm just going to apply, and maybe I'll get an interview and I won't. And the opportunity came for Gonzaga. But again, I went into that interview, I think, with the ability to draw out all of these things that I'd taken away from my education. It wasn't just, I've got 1 year of experience at University of Idaho. It was, I know how to critically assess things. You want me to read applications and tell you who to let in? Well, I spent time at the Quarterly Journal reading manuscripts. And it was my role to give an opinion about this is a good fit for this quarterly. And sometimes they took my advice, sometimes they didn't. I was still just an intern, but I learned how to do those things. Even the time I spent at the conference centers, I knew how to organize an event, and they needed someone to do that in terms of having big events for prospective students to come to. So I found ways to read through a job description, identify things in there that I could pull things from my past and say, oh yes, I can do that. Maybe I haven't done it exactly, but enough that you could say this is transferable. Yeah. But for education, higher ed, if you're thinking about administration, I mean, there's 2 major sites. There's the Chronicle and there's Higher Ed Jobs. And I found a couple of things. One was that when I worked at law schools, once I established myself and got on national committees and was willing to put myself out there, that for a couple of jobs I didn't have to look. They called me. They said, I talked to so-and-so and they said, you're good at this and would you come interview? So that was really great. And so there is that happens within higher ed to some degree. And other jobs I actually found when I was looking, not for myself, but to build a team, and came across job descriptions where I was like, oh wait, I don't think I need to hire that person. I think that's my next move. And so it was also a willingness to be mobile, and we couldn't have kids, and so that made that decision a little bit easier, that it wasn't like we had to move across the country. But I know a lot of people who do, and it is part of being in the university culture that you have to have this willingness to change universities every now and again. Yeah. Anything else? Yeah.
Talk a little bit about the style of working, where I know when you're in school, often, you're working by yourself, and then, how much collaboration is involved in the jobs that you have, and how you, whether you get training or how you apply those skills with collaborative work.
Yeah, so interestingly enough, that was, I think, part of why I didn't go back to do. I blame it on the travel, but graduate work is very isolating, and I really enjoy people. And so I think that was one of the harder things to realize, that you have to be able to function as part of a team. And that includes, especially in higher ed. So I work in an area where you've got your admissions, but you've also got student affairs, and you've also got development and all of those sorts of things. And part of it, I think, comes back to education. It's a willingness to learn. It's a willingness to learn what others are doing and to see how, again, back to connections, how are these things connected together? Because you can make the decision, and at a lot of universities it happens, that you start working in silos and you start doing what's there. But again, I think I go back and say I credit the fact that I did this interdisciplinary degree with helping me realize that I didn't have to not talk to other people just because they were in another department, that I could just go by and say, okay, here's what we're doing, and here's how I think it's connected to what you're up to. So an example of that is just recently I have one staff member who works in Las Vegas, and he came into town, and one of the things we're really working on is that there is a real dearth of African American men coming to medical school. And so he's working very diligently in Las Vegas to try to increase the number of students that are interested in medicine from some predominantly Black African American schools. And as we sat there talking, I said, I just realized that of the 5 African American students we admitted to this class, 4 of them are coming to this event in March. And so we need that's about the biggest critical mass we're going to have. And so we need to do something about that. And then we started talking about scholarships. And before I know it, we were down in the development office and brainstorming about where do we get scholarships for these individuals, or where do we pull from our physician community to do it. And I think there was a time when I just would have, stuck to what I was doing. But it goes back to realizing that you've got to be willing to work with others, and then what that's going to result in is some relationships with alumni, and we've got a lunch scheduled with a couple of people in the community to start talking about this, and just seeing how those connections are built. It is, yes. It actually comes right back to that, and gives me an opportunity to address some of these critical things that are happening within the larger field of medicine, and not just be about, well, let's admit a diverse class and call it good, but how do we connect all of these things together? Yeah. Anything else?
So this question may not pertain, it doesn't really pertain directly, I don't think, to the discussion, but you began sort of this pathway through your career by mentioning this really sort of interesting, borderline insane professor who would get up on the table and sort of reenact various historical figures. And I think most of us who sort of ended up in the academy in one way or another, it's about ideas, but also about some of these personalities that capture our imagination. Had you gone through Utah State University today, that course or a course like it might very well have been taught online.
Wow.
And I'm curious if you might speculate a little bit about what kind of a difference that might have had in your experience, sort of in your overall experience. And I was going to give you my bias in this. Some of us have this antiquated notion that professors in classrooms matter.
That is quite honest.
And while this kind of push towards online education, not just here but everywhere, has some understandable sort of roots and is addressing some real needs. Sort of, I think that folks have some concerns. So anyway, I'm sort of laying my cards on the table.
So interestingly enough, a similar thing is happening within the world of medicine. And medical students, after somewhere between 18 months and 2 years, take what's called the Step 1. And it's a licensure exam that everybody has to take in order to move on. And it's also used in helping place them in residencies, which I don't know how many of you know, but when you finish medical school, you've got 3 more years of training as a resident, and you don't get to just choose where you go. You travel the country and you interview, and then you submit your top choices of where you want to do residency, and then all of the places in the country that have residencies rank who they want as their residents, and they throw it into a computer, and there's an analog and a formula, and out comes where you get to do residency. But this test has become a really crucial component of that. How well you score on that may determine what kind of specialization you get, where you get to go for residency. And recently, the students just kind of have rebelled against going to class. They're like, I sit in this lecture and I don't really learn anything, and I need to be home studying for this exam. And so I'd rather just watch the lecture online, and I'd rather just, use this other tool and learn what I need to know to pass this test. But what's happening is that you're losing the culture of the institution, and you're losing the opportunity to make these connections and to build a sort of support system that gets medical students through medical school by being there together. And with each education is doing the same thing, that all that and more that I put up here, too many students are not having that experience. And yeah, I think what we're seeing in medical schools is a realization that we went too far. And there's conversation more and more about, we're going to have to get them back in the lecture rooms. We're going to have to get them listening. And there are things that you gain from that you don't gain from watching the video of the same lecture. And I have to wonder if there will be some schools that are able to say, we still want to deliver an education and not just a pathway to a career. And yeah, I'm concerned. And the other part of that is the very thing. So in about a month and a half, I will start the hardest part of my job, which is delivering feedback to students who were denied admission. And I limit that opportunity only to those who were not admitted at another medical school, either because they didn't apply or they just didn't get in anywhere, and who want to come and sit down and find out what they can do to improve the next time around. And it's not uncommon. A lot of medical students don't get in the first time that they apply. But the conversation that we're having that used to be held before I got there was all about, well, you need to write a better personal statement. Well, you need more hours of clinical experience. And all of those things are true, but it's why they need that hasn't been explained. And it's about, maybe your grades aren't as good, but it's not really that you didn't get good grades, but it's that you didn't show that you prioritized your education. And so you got B's in all your science courses. And you know what? You'd probably do just fine in medical school. But what we're looking for is someone says that I'm making education the most important thing. And I'm going to talk about what I did to take that B to an A, that I went to office hours, that I found a tutor, that I did these sorts of things. When we talk about clinical experiences, it's not about how many hours you went and shadowed physicians. It's about doing the experience and then reflecting on that experience and being able to articulate how it shaped you and how it changed you. Because in the end, what you didn't convince the committee of was that you really have a passion for medicine that's going to see you through the next 7 years. And so it's going to be a different sort of conversation, but I think it goes back to the same sort of thing, that we've got folks that are moving through our educational system probably the way I would have had I not taken that break and come back and had such an amazing experience with faculty. So yeah, I'm with you. I'm a little concerned.
got this great training with the writing, and I'm curious about the kinds of writing you do, different styles or different forms, like,
Yeah.
how writing intensive is your job?
So I don't learn things until I write them down. And so often what I'm doing when we're proposing some new program, a new pipeline program, is I have to write it. And so I tend to see that writing is coming to, as a way for my ideas to develop. And then what I had to learn to do was to put it in, take all of those big ideas and distill it down to a one-page summary that a dean would read, and that someone that's funding something will read, that a development officer will take the time to read. And so I think that's where I found that the writing comes into play. It's a way to develop ideas. And the other part of it, I think, is that I do a lot of presentations where I have to get the information down to a level that I can relay it to prospective students, to advisors, to that type of thing. And that the writing has been the ability to put things in bite-sized pieces that I would not have had otherwise. Where else am I doing writing right now? We're conference presentations. They're just left and right. The opportunity to share ideas about what you're doing within, especially for me with the holistic admission. I anticipate that that's an area where I'm going to be doing a lot more writing. But it's also the little things. It's constructing emails that it's how you tell someone they're not getting into medical school. It's how you communicate with folks within other departments and taking the time to think about us. I've seen such a, so often now folks aren't taking the time to think about what they're saying in an email. And yet that's the only way sometimes we have to communicate with each other. So it's the big stuff, it's the creating big, broad strategies and developing a strategic plan, all the way down to sort of the daily interactions with each other, where I know that the writing plays a difference and the ability to reflect on how other people are going to see your words.
I often struggle to explain to people, no, these jobs involve writing. It's just, you're not writing the papers that you're writing for my class, but no, this is training you to do different kinds of thinking about audience, thinking about clear communication.
Yeah, it's amazing how many times we don't think about audience. And I think that's a struggle given the texting that we all do back and forth with folks. One of the pieces of advice some of my denied applicants will get is, did you not realize that the people reading your personal statement are physicians? And yet here you are critiquing and pretending like you know how to fix healthcare when you don't have 20 years of experience with patients. Maybe you need to just think about who you're talking to and be careful about that sort of thing. So I think we have a lot of those conversations with folks, and that was drilled into me. And even just the idea of, have a thesis, have a point that you want to make, and you start with that, and then you have to provide some evidence in the next few paragraphs. Some of it is so English 101, and yet I keep thinking, did you not get English 101? And sometimes they didn't, because frankly they took an AP class or they tested out of it, and yeah.
So,
Yep, go ahead. You heard her.
You said you have a love of learning and everything, and you did say you present a lot, so you probably are constantly learning, but how do you apply the things that you're constantly learning, just for yourself or for your job? How do you apply it to your job specifically?
I think a lot of it is that I get to work with such a diverse group of individuals who are headed on this career path. So you read a book like Hillbilly Elegy, and you learn about a different part of the country and a different mindset. You read a book like Eviction, and you learn about social inequities and what's going on in communities all around the world. And it changes your conversation with folks. It brings topics up that normally I would not have conversations with a prospective student about. And yet they start tying in to being able to work with patients that are very different from yourself. That's something that almost always comes up in a presentation, that we're not just looking for physicians who are going to interact with people that are like their parents and like their siblings and like the people they went to school with. But there's a high likelihood that you're going to work with someone who just got evicted from their house and can't afford medication. And so being able to keep bringing those things back in, and a lot of it goes back to that social justice, that I love being part of an environment where I'm in an institution where it's sort of part of our mission that we're doing that. And it was part of the draw of being engaged in education and being part of institutions that say we want a diverse workforce and we want people who can interact like that. So yeah, I keep reading, but the other thing that's amazing about admissions and going from law schools to medical schools to engineering is that everywhere I went, nursing, I would just be like a sponge learning about that industry. It wasn't enough for me to just recruit students. I wanted to know how they were going to fit in and what they were fitting into. And so by the time I finished working with law schools, everyone thought I was an attorney. By the time I got to nursing school, I can't do science. I love science, but it's not my thing. But what I would have my dean introduce me, this is Tamara. She's not a nurse, but she speaks nurse. And it's something that if you go into the world of admissions, it's what does it for you, is you take on the passions of those around you in a sense. And so yeah, in the books that are lining up for me to read are books written by physicians about what it means to be a doctor. And so I feel like I get to just keep moving into these different realms and absorb all this new information. And I'm starting to know more about healthcare than I ever would have, just simply because I'm talking to people all day long that think that that's what they want to do. Yeah. You had a question?
Yes, I had a question. You began your story of critical thinking and then moving to critical action, the things that you do. This idea of reinventing yourself, moving from one place to another, and constantly learning. I understand that. Can you talk about family and community and how you balance this superwoman with family and community?
You know, it's a hard thing to do. And a lot of it comes back to, actually comes back here again. And when I mentioned Steve Saporin and taking his folklore class. And that actually also changed my trajectory because I did an oral history with my grandmother. And as I mentioned, my father was from New Mexico, and his family left New Mexico to work as migrant workers in the fields of northern Colorado, and then went to the railroads in Cheyenne, Wyoming, and then finally to the copper mines here in Utah. And learning about my grandmother through that was probably as much inspiration as anything for the work that I do. But what it came back to is that with family, I am still the only person to go on to any kind of higher education as my family. And it meant that I had to find ways to communicate with them that were different than the world that I live in every day. And I still spend a lot of time with nieces and nephews and parents and grandparents up until my grandmother passed, and really find ways that, and maybe I was lucky because I traveled all the time, so I got to come home often. But at the same time, what it means is that I found that a lot of my world revolves around the students and the people that I work with. And I think that had I had children, that might be different. But it's like I have hundreds of children now instead. For those that think that's I mean, you make choices. And I think there was a time when we thought you can do it all, and maybe you can. But in the end, I find joy in what I do every day at work. And so I don't feel like I've missed out on something. But it's a really personal decision to decide how you're going to work that in. In terms of community, every place I have gone, I have found a community. And that's one of the cool things about living in different places. So for my 50th birthday, my family has a home in Yellowstone, and I put the word out to everybody everywhere. And over the course of a month, I had about 40 people come through that house because they wanted to go to Yellowstone, but it was also this way to say, look at this interesting community that I've built over the years from Oklahoma and Michigan and Washington, and they just came from everywhere. So I think in terms of family, if, you know, in retrospect, what I've done is created a family of people who are passionate about the same things that I am, and who want to give back. And they are the folks that bring meaning to everything that I do, whether they're students or whether they're coworkers or folks that I've met within larger national organizations. Yeah. Yeah.
So you said something really interesting about this example of a letter, right? A letter for admission into your med school, where a student is basically articulating how they're going to change the U.S. healthcare system, I guess.
Mm-hmm.
I can envision that being like one of our students, right? And so all of these things that you're discussing about being sort of developing a sense of social justice, having a critical mindset. Maybe this person took a course in medical sociology or something, so they know just enough to be dangerous for the U.S. healthcare system. And so I think what I'm asking is how do you take all these great things that you've just articulated and kind of balance them a little bit with some sense of like perspective, experience, data, and are those things that we could, and to some extent, you know, I think that we do, but are those things that somehow we could build into the curriculum as well, to kind of provide a little balance to the whole sort of picture that you presented to us so far?
I would say that the way that if I were in your shoes to build it into the curriculum is creating space for reflection. And I got that by the journal that I took in a women's history course, where we were just asked to journal and find ways to turn it back on ourselves. I think that's an amazing tool, and it's something that I challenge pre-med students especially to do, that every time you have an experience, every time you go volunteer at hospice, you've got to take the time to write about it and reflect on it, because what you're doing is building up all of the things that are then going to allow you to write a powerful essay about why medicine and why that's the direction you want to go. And yeah, learning enough to be dangerous. That's where I think the maturity comes in, and the ability to be humble and to think about, again, who are you writing this for? And can I do this in a way that says, you know, I read about this, I've got some ideas, but I also get that there's a lot that I still don't know, but I want to know it. And so I think that's the difference, is creating that desire to know more, to fit it, you know, see those connections, to know that you've got some confidence coming in, and that you've built up a little bit of a record of success and passion and dedication and all of those things, but that you're still at the beginning stages of these. And so kind of letting students know that it's okay to talk about what you've learned, but you also have to be cognizant of what you've yet to learn. Yeah. You had a question?
Yeah, I guess it's kind of related to like what you guys are all talking about. So I feel like I'm definitely, maybe like by default, that kind of like, oh, dangerous, you know. I do have these underlying feelings of like, wow, the system is terrible, you know, all that. But last semester I did an ethnographic research project by interviewing physicians who take care of type 2 diabetics. And I definitely had to restrain myself from like letting any of that sort of bias into our conversations. But I feel like towards the end, I did kind of get this open perspective where I almost felt like guilty for like, you know, I learned all these things about like injustices, but then I had to like reel it back, like, well, it's not really that bad, but then like it is, but like it's not. And kind of when you get that like golden mean of like realizing how, you know, the actual individual positions in these positions like kind of interact with the systems that create inequalities and give and take with them, and I feel like you actually do kind of realize something important about like everyday interactions and how like, you know, they might interact with each other in the clinic to like alter practices. And, you know, once you kind of get that kind of like juicy stuff about like how like actual physicians are interacting with these systems and trying to make change, or like once you kind of do realize that stuff, like what's next? How is that applied in the real sense? Because you can like research that all day, but like what is that?
So, kind of where do you see yourself? Is that what you're asking? Where do I fit into this?
I don't know. I just think like what are the different if you have that kind of information, that like juicy information that's like in between, the whole anarchist, the system sucks, and then like the practical, and like you kind of have some connection between that. What are like the avenues for like going after that and applying that or spreading awareness or making changes or something?
Yeah, I think the hard thing is deciding, are you going to do it through the academic world? Are you going to keep writing about this and doing research? Or are you looking for the practical?
I don't know.
Because there's masters in public health. There's masters in public, healthcare administration. And those are the individuals that are kind of tasked with that I'm going to take this information, I'm going to figure out how to apply it in the hospital that I work in, within this healthcare system. But it's easy to lose your way doing that because, I definitely saw it. You work for big industries and they start talking about bottom line, and in the end, a lot of those important things get cut out. So you've got to be brave. You've got to be willing to walk away sometimes. I've walked away from an institution that became so convinced that they just needed to raise the number of students and increase the dollars coming in that it just became, I couldn't convince, I didn't want to talk to anybody about going to school there anymore because I was worried that they would just go into debt. So, but at the same time, I learned a lot about myself, and I learned a lot about kind of how institutions work, and I learned what questions to ask in the next job to find out if it was a place that I would fit in, and it was okay to do that. So the same way that if I went through all these different positions that I've had, each one of them had the pros and the cons, and sometimes I made a little bit of a difference, and other times I felt like I really left something substantial there that changed the trajectory of what they were doing. It's kind of that willingness to say, okay, I know that there's some things out there that I care about, that I want to make a difference. Yeah, the system does really, really suck. But there's also good people out there who are really trying day in and day out. And some of it do it on the individual level, and others are looking at population health within certain communities, and others are becoming those people that change organizations because they're just a force. So it's okay to hit walls every now and again. I would say that's the thing, is to figure something out and then get in there and try to make a difference and hit a wall and say, okay, well, what did I take away from this experience? And now I'm going to go somewhere else and I'm going to try it again. And maybe it'll be in a slightly different area. But I'm really a believer in, it's kind of like the compound interest of learning, that each place you go, you pull in a few new things and a different approach. And you have to be patient. Unless you get incredibly lucky, it won't happen at the first place you go because you won't be ready for it. I don't know. Good for you, though. Yes?
So kind of shifting gears, I'm very similar in the same boat where as I learn about different courses, I want to take courses over here.
Mm-hmm.
Homicide, I want to do this. I'm an advisor for history, I want to take these classes. If I can down about legal stuff, I want to learn about that. And even with that and the different extracurriculars that the university has, or different things that you've mentioned, like different committees, even just different books that you want to read, kind of a thing. There's just so much out there, and I would love to be a professional student, but I don't think I could be in school for 20 years. I'm how do you prioritize what courses you take, what you read, what committees to sit on, where you spend your time? How does that prioritization work?
Yeah, I'm still learning to say no. It's a lifelong endeavor to figure that one out, and I'm probably not the best person to offer advice on it. But I have this inner sense that I'm going to know what to do next, and I don't know what it is that says it's time to read this book right now. And I put a lot of stock in just intuition that says you need to be in this room right now, or you need to listen closely to what's going on. And I don't know whether I'm really just, whether it's intuition or whether it's other things. I'm a big fan of Malcolm Gladwell's Blink, that our brains actually process things faster than we realize they're doing it. And that sometimes you're seeing multiple things in front of you that tell you this is what you should do. And so I think some of it goes back to relying that I took all these things away and just letting my brain do it. That I'm seeing something that says this is what's next, or pay attention to this class. And then having some faith that whatever direction I go, I'm going to get something out of it. And I do try to live with no regrets that I should have read that book back then because maybe I need to read it in 5 years. Maybe it's going to have a place there. And then just doing the best with wherever I'm at. If I'm at the table when an important conversation is going, then I just feel like I was meant to be there. And yeah, I think there's probably people that could tell you how to plan that a little bit better than I have. But so far it's worked. And I think part of it is just being like, wherever I'm at, I'm going to get the most out of I can out of that situation. And I'm not going to wonder what would have happened there. It would be great to be a professional student. It would be great to spend your whole life just learning and absorbing. But the downside of that is you don't always get to have impact if you don't stop and start applying what you've learned. And kind of have some faith that the next time you need to learn a new piece of information, it's going to be there waiting for you. Yeah.
So it seems to me like you're in kind of two different worlds, like you're advising or helping students who already know they have a career path, the sciences or medical field and so forth, and then we're here in the College of Humanities and Social Sciences, which is lovely and I love it. But like I know in exploratory advising, I have a lot of social science students who are like, what do I do? What's my career? So how would you mesh both different types of education? And you kind of being both. You came from the social sciences, but you are working with students who actually have
a very defined path. Yeah, some of it is that I'm actually starting to spend time with the College of Liberal Arts at my university. And because there are individuals within liberal arts that now want to do something like medicine or want career paths like that. So there's a little bit of that going on because I'm such a believer in these things that I took away that I know that had somebody told me that I could be a physician, I might have gone back and like dug in and taken science classes because I could see the impact it would make. But when you're working with those who are exploring, and I got a lot more of those in law school with those that were trying to find something to sink their teeth in. But I was also there at law schools when they raised their tuition so fast that students were graduating with so much debt. I was like, yeah, going to law school is a great furthering of your liberal arts education, but not at this cost. So you need to go back and think about what's important to you. Wow. Think about some of these students I'm seeing these days. I think I'm going to go back to the journaling and writing and the reflecting. You got to start thinking about what's important to you, what brings you happiness, spending a little bit of more time thinking about what you got out of that class instead of just that you got an A in it, and really challenging yourself to say, where do I need to be? And in some ways I feel incredibly lucky that I landed where I did, but some of it is also letting them know that you've got these key skills. And when you look at job descriptions, you need to start paying attention to what they're actually looking for and then envisioning whether you can do that. Because they are asking for writing skills and they are asked for critical thinking. It's just, it may not be in exactly those words. But boy, I don't know, you're in a tough role to, especially at this stage. I think the other thing is that I would encourage folks to say, just go try something and give it your best shot. And, whether you are again, starting as an administrative assistant, that could have been my life. I could have sat at that same office until I retired. But if you bring these skills into that job and you pay attention and you talk to people and you bring that sense of, I want to learn everything about this business, I have this sense that I could have, instead of landing as an admin assistant at a university, I could have done it at a big company in a temporal, kind of like my mom did. And that it's that willingness then to just say, I want to learn and I want to understand what's going on here, and I'm willing to talk to people, and I'm willing to show up at office hours or take someone to coffee. I just still believe that has the opportunity, and that if you have these underlying skills, that doors open. I could be wrong. Anything else? This has been fun. Thank you so much. Yeah.